community.
Good afternoon, everyone. My name is Tawana Mitchell, and I want to thank you all for joining this afternoon's virtual town hall hosted by Kaiser's Equity, Inclusion, and Diversity Council in partnership with Kaiser's African American Professional Association. I want to take this opportunity to quickly go over some house rules. Everyone on the line has been muted. All responses, vocalized in chat, are welcome. Each activity will have a time limit to ensure that we deepen our listening. This session will be recorded to ensure we have captured the quality of your responses. To vocalize your response, please use the raise your hand function. Your name will be called in the order it was received. Please limit your voice response to 60 seconds to allow time for others to participate. And we ask that you stay present and be mindful of all participants. I would also like to add that we understand that there are some very important questions that you may want to ask during the question and answer portion of this listening session. We invite you as part of the LAMC community to participate openly and freely. This is a safe space, and we encourage you to ask any questions you may have. Our goal today is to educate and provide you with a better understanding of the COVID-19 vaccine. At this time, I would like to invite one of our oncologists here at LAMC, Dr. Tiffany Hogan, as well as the physician champ for the Equity, Inclusion, and Diversity Council, to introduce our guest speaker for today's listening session.
Thank you, Ms. Mitchell, for that nice introduction. So, I want to tell you a little information about Dr. Elizabeth Hudson. So, Dr. Elizabeth Hudson is a proud New Yorker who managed to escape the cold and snow and made it to sunny and warm California with her husband of 22 years and wonderful son. She is a physician of mixed race background whose parents were married just a few years after the well-known Loving versus Virginia Supreme Court case of 1967, which legalized interracial marriage in the United States. She completed medical school at Western University of Health Sciences, followed by a combined internal medicine and preventive medicine residency at Griffin Hospital at Yale University. She also received a master's in public health from Yale University during her residency. She successfully completed her infectious disease specialty training at Stanford University. Dr. Hudson has been with KP since 2007 in the Department of Infectious Diseases at Panorama City, serving as its EID chief since 2015. Most recently, she was appointed as the KP Regional Chief of Infectious Diseases. She is passionate about closing healthcare disparities and providing high-quality care to a diverse patient population. She has special interest in HIV care and HIV prevention. We are very lucky to have her here at KP. Please give a warm LAMC welcome to Dr. Hudson.
Thank you. Thank you so much. Thank you, Dr. Hogan, for that lovely intro. So I just want to say on behalf of all of Panorama City here, I just want to really thank you for allowing us to be a wonderful part of this presentation today. My goal today is really going to be to try to educate, inform, try to do some myth busting here when it comes to the COVID-19 vaccine, and then just to answer any other questions that might come up too.
Thank you, Dr. Hudson.
Thank you. So we're going to get right into this discussion here. So I really want to kind of level set here. We know that medical research and people of color has a troublesome history, and that's putting it mildly. I've just put a few of the the issues that come to mind the most when we think of some of the challenges that people of color, particularly African Americans, have experienced at the hands of our medical system. The picture in the upper left is actually of Dr. Marion Sims. He's the so-called father of modern gynecology. And the woman who is sitting there, who is the patient, is a slave, and she was one of the many female slaves that this physician did a lot of research on in terms of trying to understand various gynecological issues. All of this was done without anesthesia on these enslaved people. The next picture that we're looking at is a really wonderful picture of Henrietta Lacks, and I know that there was a discussion on Henrietta Lacks just a few days ago here, but for anyone who does not know, this woman had cervical cancer and her cells were taken. She died at a very, very young age, but these particular cells are called HeLa cells, which is Henrietta Lacks, and these are the cells upon which almost all of our modern research has been based on, and without all of the contributions that Henrietta Lacks gave, so many of the different medications and treatments that everyone depend on would have never happened, but it wasn't something that was known until very, very recently. And the lower picture there is a picture from the Tuskegee syphilis study. I think it's important to have a picture like that in color, because it's important to know that this particular study ended the year that I was born, in 1972. And I'm getting old, but I'm not that old yet. So this is really recent history. So there are many reasons that people of color have to be distrustful of the medical community, and also of any kind of new types of treatments that come along, because we know that the history shows that oftentimes people of color, particularly African Americans in the United States, have been experimented upon. So we can go to the next slide, please. So these are the questions that I know I asked myself when I first heard about the COVID-19 vaccines, and I'm sure everyone on this call has questions about. The questions are, how could the vaccines be developed this quickly? Are they safe? And what's actually in them? We can go to the next slide. So I think it's very, very important to know a little bit about sort of what happened in terms of the development of all of these vaccines. So it's really, really important to know that these vaccines were created relatively quickly. However, there's an extraordinarily large amount of research that went into this. There are various phases of research. We call it phase 1, phase 2, phase 3 studies, as we are bringing anything new to market, whether it be a medicine, a vaccine. All of this did happen for the COVID-19 vaccines. I think that that's a very important point to note. It did happen a lot more quickly than we would normally have sort of seen in the more distant past, but that does not mean that corners were cut, that the efficacy, the safety, there were not shortcuts when it came to any of that. And I think it's very, very important to know that Kaiser was actually very intimately involved in the studies for the Moderna vaccine and for the Pfizer vaccine. We actually participated in several of the phase 3 clinical trials for the COVID-19 vaccines. Now, phase 3 is when the vaccines have already made it through at least phase 1 and phase 2. So there have been many people who have already received the vaccine safely. This is when the vaccine is going out to larger groups of people. So Kaiser was certainly involved with that. Right here in Southern Cal, we actually participated in phase 3 of the Pfizer trial. Other though throughout the Kaiser Northwest, Kaiser Colorado, Kaiser Georgia, they also all were part of these clinical trials. And it's also very, very important to note that all of these clinical trials were there. We have the FDA reviewing it, other various governmental agencies looking at it. But it's very important to know that Kaiser itself also reviewed all of these vaccines. There is a national infectious disease group of all of the various Kaisers who looked at all of these vaccines. Additionally, within Southern Cal, we have a regional infectious disease group. It's a large group of all of the infectious disease doctors in SoCal Kaiser, and all of us also looked at these vaccines. So it's very, very important to know that there were multiple eyes, multiple levels, multiple different kinds of people looking at these vaccines, making sure that they were safe, efficacious, and really wanting to make sure that before we offered them to any of our members, to ourselves, that we really felt comfortable that this was going to be a safe thing to do. So we can go to the next slide. So this is a little bit more about the approval process for COVID-19 vaccines. We all probably heard, going back about a year or so ago, this quote, Operation Warp Speed. That was the federal government's response to trying to create a COVID-19 vaccine safely and quickly. Truly, this was something that we have never ever done in modern medicine, to pull together this many governmental agencies and also more independent groups. As an example, the company that created the Pfizer vaccine is also, it's the Pfizer BioNTech vaccine. That BioNTech was actually a separate, more of a private group who had created this vaccine. So it's very, very important to know none of these steps were skipped. You know, all of the results were very closely reviewed by the FDA and other governmental organizations. Truly, the vaccines were shown to be safe, effective, and at that point, the FDA gave what we call an emergency use authorization, so an EUA for the Moderna and for the Pfizer vaccines. And it is important to note that probably now, actually, I think the FDA is likely going to be releasing an EUA for the newest vaccine that to come out to the market, which is the Johnson & Johnson vaccine. We can go to the next slide. So what vaccines do we actually have now, and what's actually in them? So the two that people are hearing most about are going to be the Pfizer and BioNTech. So that's one of the mRNA vaccines, and the Moderna vaccines. Now, some people on this call may have already gotten one of these vaccines, hopefully maybe even 2 doses, so you'd be fully immunized. It's very, very important to know, though, that the studies that were actually done on these really included relatively large numbers of people. So we're talking, for the Pfizer study, it was about 45,000. For the Moderna, it was about 30,000. And what was really, really important to see is that there was about a 94 to 95% effectiveness for these vaccines. Now, I will tell you, as an infectious disease doctor, that makes us extraordinarily happy. It is not typical for a lot of our vaccines to have as high of an efficacy rate. I'm sure everyone here knows about the flu vaccine, and the efficacy rate for that can vary greatly. So certainly having something that is going to give us that kind of protection is absolutely tremendous. It's very, very important to know, for the Pfizer and for the Moderna, these are going to be the 2-dose series. So Pfizer, you get your initial dose and then another dose 21 days later. Moderna, initial dose, another dose 28 days later. So a little bit of a difference there in terms of the timing, but these are very similar types of vaccines in the way that they work. And I'll get into that just a little bit there too, to talk about how the Johnson & Johnson vaccine likely will get its EUA today. There are other vaccines out there. There's the AstraZeneca vaccine. There's a Novavax vaccine. These are not being used in the U.S. yet. They're being used in other parts of the world. There is a massive race on throughout the entire world to really try to get as many efficacious vaccines out to market as quickly as possible. Next slide. So I wanted to talk a little bit about the mRNA process. I know that a lot of people have heard this, and as soon as people hear RNA, they think DNA, they think, oh my God, what is this? It's going to change maybe the way that my cells work. It's going to change the way that, my entire DNA if I get this actual vaccine. And that's not, happily, that is not the case. These vaccines do not enter your DNA. They cannot change anything along those lines. And actually, mRNA technology is not something that is new. It's actually something that's been around at least going back to the SARS outbreak towards 2003, 2004. And it actually is a very ingenious way to create a vaccine, because what it actually does is this vaccine actually helps your body to create proteins that are actually found on the outside of the virus. And because your body sees those proteins, it actually induces your own immune system to say, hey, wait a minute, what is this? And your own immune system makes antibodies against it. So if you are ever exposed to the COVID virus, you already have these antibodies here. So this is very different from most vaccines. Most vaccines, it gives you either a slightly killed version or sometimes even a little bit of a live version of the actual infection. This is acting completely differently. It is really utilizing your body's own response to this piece of protein to create an antibody response without you really having to be actually infected or exposed to the COVID virus. We can go to the next slide. So just a little bit more about mRNA. These vaccines do not use the live virus, which is wonderful and different. Probably, I think that the way that these vaccines have been made might be the model for future vaccines going forward, because it is a very new way of actually giving really good protection. And as I said before, these vaccines do not interact with your DNA at all. It's very, very important to know that within our cells, the DNA is actually kept in a very special part. It's in the nucleus of the cell, kind of in the middle of the cell. So this vaccine has absolutely nothing to do with this. So by getting this vaccine, you are not interfering at all with your own cells work and your DNA. You don't have to worry about anything like that being changed by this vaccine. And we can go to the next slide. So big questions we always get asked are, what are the possible side effects that you could feel from this? So we can go to the next slide. So for anyone on this call who's gotten the vaccine, we know that there can be some side effects that we feel with it. You can get like a sore arm. Some people get a headache. Some people get chills. You can get muscle pain, joint pain. Sort of similar actually to what can happen if you actually get COVID. For most people though, these side effects are extremely short-lived, like I'm saying 1 to 2 days. And although there's a lot of people that talk about how many people have gotten side effects, truly it's about 40% or so of people who tend to get any kind of side effects. So that means 60% don't. I will tell you my own personal experience. I got my 2 doses of the Pfizer. The first dose, my arm was a little bit sore, kind of like after you get a tetanus shot. The second dose, I was a little more concerned, because we do know sometimes that people are going to have side effects. It's going to happen more with that second dose. But I will tell you, I had absolutely no kinds of effects at all. Quite frankly, I was kind of waiting for it to happen, and it actually didn't. So it's very, very important to know that even if people who say, oh, I got the vaccine, I didn't feel well, that's not a bad thing. That actually means that your immune system is actually making a good response. But if you get the vaccine and you don't have any side effects, that doesn't mean that the vaccine is not working. It means that you are in that 60% of people who just didn't get any kind of side effects from it. It's very, very important to know, though, that when you get the COVID vaccine, everybody is watched for at least 15 minutes afterwards. That's just to monitor, just to make sure that you are doing well, and God forbid you don't have any kind of an allergic reaction to it. If someone goes in with a history of allergies, they are actually monitored for a minimum of 30 minutes. Happily, the allergies that we are seeing now that we have a much larger experience in terms of the vaccine are happening extraordinarily rarely, no more frequently than we see with any other vaccines. And it is important to know that if someone is going to have an allergic reaction to the vaccine, it's most likely to happen within the first half hour, which is why we monitor people for that first half hour. The staff who are there are all trained in what to do in case someone does get an allergic reaction. The KP allergy physicians have actually created a whole training guide on what to do if someone gets an allergic reaction. And it's very, very important to know what an actual allergic reaction is. You know, allergies are you get hives, you can get a rash, your lip feels like it's swelling, your tongue feels like it's swelling. Sometimes your blood pressure can drop. Most of the people who get side effects after the vaccine, what I have seen, much more likely to be related to more of an anxiety picture. Some people's blood pressures have gone up. Some people say they're seeing spots. Some people just start to feel really like they start to feel like their heart is starting to race. All of those things are not likely to be allergy, rather just the fact that we're just a little hyped up before we go to get the vaccine, and we get a little bit nervous, and that's just our body's response to it. So we go to the next slide. So this is something that I think is very, very important, because we're all interested to find out more about everyone's experience in the real world with the COVID vaccine. So after you get your first dose, you actually are given information on how to download what you are seeing here, which is called an after vaccine health checker. It's actually great. I have done it with both of my doses of vaccine, and you sign up for it. It's very, very, very easy. And it asks you if you're having any kind of side effects, if you've seen the doctor. Even right now, I'm about 6 weeks out from my second dose. And just yesterday, it sent me another little mail and said, hey, are you having any side effects from this? This is how we're going to get a lot of really good real world data in terms of seeing, as the vaccine is given to more and more people, what kind of potential side effects may actually be happening. Go to the next slide. So why should you get the vaccine? And this is a really good question. We can go to the next slide. So we know that even though the surge is better, COVID is not gone by any stretch of the imagination. So whenever you are out and about in Los Angeles, there's a good chance you are going to be potentially exposed to someone who has COVID. So many people don't have symptoms, so it's extraordinarily important to make sure that you are vaccinated so you can protect yourself. And you are not only protecting yourself, you are protecting your family, you're protecting your patients, you're protecting the entire community by getting vaccinated. And it's really, really important to know that because people of color have not necessarily always been included in all of these discussions about vaccines and who's going to get them, that we really want to make sure that our communities are really getting the protection that they need. COVID-19 has had a disproportionate impact on communities of color, and the way that we get out of this pandemic and get people well and get everyone to stop wearing masks is by getting vaccinated. Next slide. So just a couple of things I want to separate out truth from fiction. I've heard from several people that they think that the COVID-19 vaccine causes infertility. That is simply not true. There is no evidence that links COVID-19 vaccines to infertility. So far, we've had about 20,000 pregnant women who have been vaccinated, and they have experienced no ill side effects. And it's very important to know that people who are pregnant and get COVID, they are 3.5 times more likely to end up in the hospital and 13 times as likely to die from COVID compared to people of the same age. So the bottom line is we want to protect pregnant people, people who are thinking about getting pregnant from COVID. And the way to do that, get the COVID-19 vaccine. We can go to the next slide. So another thing I've heard, people think that the COVID-19 vaccine has a microchip in it. That is absolutely not true. There is no microchip in it. This vaccine is not tracking or gathering any kind of information. But I'll tell you what does have a microchip and does track us, your phone. So there is no microchip in the COVID-19 vaccine. I see it says COVID-10, but it should say COVID-19 vaccine. We can go to the next slide. So this is another question I get asked a lot. Can I get sick with COVID-19 if I get the vaccine? No, you cannot get COVID-19 from the vaccine. Remember, the COVID-19 vaccine does not contain the virus, so you cannot get COVID-19 from it. And there's just a really funny meme that I found of a really good way for everyone to understand how the mRNA vaccine actually works. We can go to the next slide. So just a couple other little quick questions and answers here. Some people say, hey, I don't need the vaccine. There's going to be herd immunity soon. I'm fine. That's completely not true. Herd immunity is only achieved by getting more and more people vaccinated to stop the virus from actually circulating. The more that people think that they can rely on herd immunity to not have to get the COVID-19 vaccine, what that actually means is more and more people are going to get infected and more people are going to die. We've already had 500,000 Americans die from COVID. And I know that we talk a little bit about it, but it's really, that needs to really sink in. And when you look at the racial breakdowns of that, the disproportionate impact on communities of color is truly breathtaking. And it's very important that we all do our part to make it so that hopefully we will see an end to this pandemic soon through vaccination. Another question, I've been vaccinated, I don't need to wear my mask. There's actually really good evidence after the 1918 flu outbreak in San Francisco. They actually had parties where people were throwing off their masks. And what they actually found was that that led to this third huge surge in the 1918 flu pandemic. It's very similar now. There is a lot of the virus still circulating. And although the vaccines are really good, they are not 100% protective. So the way to keep yourself protected, still get vaccinated, and then after we get vaccinated, still wear your masks, still physically distance, still keep with that diligent hand washing. All of that is going to be important, probably at least throughout the end of 2021. Someone also asked me, oh, I've had COVID, I don't need to get vaccinated. Well, it's very possible that you can get COVID, even if you've had it before. There are many different reasons for this. One thing is some people get COVID and they don't get as much of an antibody response, so they're more likely to potentially get it. It's also possible that there are new variants out there that perhaps you maybe had one variant and not the other. If you get the COVID-19 vaccine, you will be protected against it. You can go to the next slide. And now it's just time for questions. So thank you.
Thank you, Dr. Hudson, for that very thorough slide presentation. I want to go ahead and get right to the meat because the questions are coming in, and I want to make sure that we answer all your questions. We are monitoring them, and I really want to thank you for addressing the fertility issue, the microchip issue, and the impact of the vaccine on those who may have had COVID-19, because we got a lot of questions about that. And I also want to mention, for those of you who may have joined the call late, Dr. Elizabeth Hudson will be answering the questions, and I just want to remind you of her credentials. She's a hospital epidemiologist and Chief Infection Control Officer at Kaiser Panorama City. She's the Chief of the Department of Infectious Disease at the Kaiser Panorama City, and she's also the Regional Chief of Infectious Disease for SCPMG. So Dr. Elizabeth Hudson knows her stuff. I'm going to jump right into the questions because we've got a lot. So we are speaking with someone who knows her stuff. This is the Regional Chief of Infectious Disease. One of the questions I was asked to clarify is, can you get COVID-19 after receiving the vaccine?
So that is an excellent question. And the answer to that is yes, you certainly can. There could be a myriad of reasons for that. First reason could be because we know no vaccine is 100% effective. So it's possible that of the 95% of people who are, have the good protection, maybe you fall in that 5% that doesn't. So yes, it's possible. It's also possible because this virus is out there circulating. The more that it circulates, the more chances it has to make mutations. And these mutations allow it to potentially, some of the mutations make the virus less able to infect, but some of them make it much more likely to not only infect, but to cause more severe illness. And also, the mutations can make it so that the virus might be able to sort of outwit the vaccines. So far, we don't have one that's doing that to a huge degree, but it's certainly possible. One thing I do want to say though is, if someone gets COVID after they've been fully vaccinated, and it's the 2 weeks past their second dose, because you're not fully vaccinated after the first dose, obviously. You're not fully vaccinated the day after the second dose either. It takes another 2 weeks to build up full immunity. If people get COVID after that point, the chances are that the COVID infection that they get will be much less severe, and also much less likely for them to end up in the hospital from it. So even if you do get COVID, it's not going to be the severe case that you would have gotten if you were not vaccinated.
Thank you for that very thorough answer, Dr. Hudson. I'm just going to keep going because these questions are rolling in.
Good.
The next question is, how does the COVID-19 vaccine affect people with autoimmune disorders or are somehow otherwise immunocompromised? Is there data on how it impacts these individuals?
And that is a terrific question. And I will say this, there is not a lot of data yet, because this is still such a relatively new vaccine that we're dealing with here. We don't have as much data as we would like on people who are immunocompromised. That being said, however, there were people who were immunocompromised within the studies, and they all seem to have a very good response to the vaccine. So while it's certainly possible that there could be exceptions to that rule, just like everything in life, it's a risk-benefit situation. So if I have a good friend who has MS. She was asking me, she's on multiple treatments for her MS that have made her immunocompromised. And she said, should I get vaccinated? And she said, and if I do get vaccinated, is it going to work? And I said, well, you definitely want to get vaccinated because we need to give you some form of protection against the COVID-19. Now, is it possible that she won't have as robust of an immune response as maybe somebody who doesn't have MS would? It's possible, but is it also possible that this bit of response that she does get, God forbid she gets COVID, will keep her from having as severe of a case? Yes, I think that's almost certain. But as time goes by, we will get a lot more information on this. I will tell you, I personally am highly encouraging all of my HIV positive folks to get vaccinated, because we know that the vaccine gives protection. And even if it's not 95%, it's still better than what they would have without it.
And what about organ transplant post-recipient patients? Are they eligible for the vaccine?
So they definitely are. There can be some caveats, I would say, for them, only because sometimes they're on different kinds of medicines that might need to be separated out timing wise from the COVID-19 vaccine, but they definitely still would be candidates, yes.
And there's another question, Dr. Hudson, for those of us who have been vaccinated. If we have already received both doses of the vaccination, will we need to get a booster because of the variants?
That is an excellent question, and I don't have a crystal ball, but I will tell you what I think. I think that yes, we will probably need to get boosters. I am concerned about a particular variant that's called the South African variant, and I'm a little concerned now. There's another variant that's been found in New York City, which is very similar to the South African variant. This variant is a problem potentially because it knows how to outwit some of the vaccines. The Johnson and Johnson certainly probably doesn't work as well against it. The Moderna and Pfizer, they do seem to work, but maybe not as well. So Pfizer and Moderna are already working on boosters potentially against the South African variant. I believe that actually Pfizer has already put something over to the FDA about this within the last day or so. So I do think we may need a booster for the variants, but this all speaks even more to the fact that people, if we can get people vaccinated, we can stop the virus from mutating because it won't be out there circulating. Then we won't get more variants, then we won't need more boosters.
Thank you, Dr. Hudson. And for those of you on the line right now, the chat is open. We are monitoring the chat. Please feel free to send your questions forward. This is a safe space. We want you to speak openly and freely. There is no such thing as a stupid question. This COVID vaccine is new to us all, and we really want to make sure that you leave this phone call feeling informed and educated. I'm going to go ahead and continue the questions. Dr. Hudson, is this vaccine going to be annual, and how long will the protection last?
That is a terrific question. So I will say, again, we don't know 100%, but I'll look into my own crystal ball here. I think that probably this is something that we will need to get revaccinated for, maybe on a biannual basis, maybe a triannual basis, maybe a little different than the flu, than the flu shot, which is more annual. But I do think that probably the protection from these vaccines, they'll last at least 1 to 2 years, and they could last longer. It's certainly possible, but I think that probably this will be something that we will all need to get boosters against. And I would certainly expect COVID, although hopefully we will never have a surge like the one we're just coming out of. It may be something that every year, you know, and during cold and flu season, maybe we'll call it cold, flu, and COVID season. There'll probably be a time when that is something that we'll be seeing, because I don't think COVID is going to like one day just completely disappear. It will probably still be there in the background, but the more people we can get vaccinated, the more we can tamp it out, and the more we can get back to some semblance of normalcy.
Great. Thank you, Dr. Hudson. And this next one is a two-part question. For those who want to get vaccinated, but maybe have severe anxiety around needles, can you take a numbing cream before receiving the vaccination?
So that's an excellent question. As someone who lives in a home with two people who are of course male, who are very, very afraid of needles, I understand the concern around it. I don't think that there would be a reason you wouldn't be able to put a numbing cream on if it's something that you would normally do before you get a vaccine. There's nothing in the needle that would necessarily cause a problem with the COVID vaccine and using a numbing cream. I will say this though, I am a connoisseur of vaccines. I think I've had almost everyone out there. And this vaccine, this needle is the least painful needle I have ever had. And I will say the person in my house who has the most fear of needles is my husband. And got his first dose and he said, I didn't feel anything. So that is a really, truly a wonderful thing to hear that makes me think that, okay, this is something that's not as, it's not as painful as some of the other vaccines that we've all had to experience.
Thank you. And Dr. Hudson, can a pain relief fever reducer medication be taken when getting vaccinated? And if so, before or after?
Excellent, excellent question. So we really recommend that you don't take Tylenol, Advil before you get the vaccine. We don't want you to take that because in theory, those medicines are anti-inflammatory and they could decrease your own body's response to the vaccine. However, if after you get the vaccine, if your arm starts to get really, really swollen, if you get a fever, if you're just kind of not feeling great, you can definitely take Tylenol and Advil then. We just don't want you taking it beforehand.
And what about vitamins? Can you take your normal vitamins, vitamin B, vitamin C, vitamin D? Are those okay to take?
Absolutely, they are. Yes, you can take all of your regular vitamins. There's no interaction with the vaccine at all.
Thank you. So Dr. Hudson, I'm getting ready to get in some of these tough questions that are specifically surrounded around the African American community and other racial ethnic populations. So again, I want to let you guys know I'm monitoring the chat and I am getting to some of these tough questions. Is there any truth to the thought that the Moderna vaccine has less chance of side effects for people of color?
So I will say that I have not seen any data around that at all. No, there's no difference in terms of side effects based on whether it's people of color or people who are not of color. It's the same type of potential responses. It's the same. About 40% of people tend to get a response. About 60% of people don't. I will give you a little bit more of an anecdotal or story info here that is not evidence-based, but it's something that I've definitely seen. I see more people getting side effects with the second Moderna shot than I have with the second Pfizer shot. I'm not really sure why. It's just something that I have noticed among my own physician colleagues and others. It doesn't mean that the Moderna is better, the Pfizer is worse. It's just the way that these vaccines are reacting in certain people. But I will tell you that what I have seen, it doesn't break down along any racial lines, gender lines. It's kind of, it just sort of just happens. It's a much more random.
And are we doing anything, Kaiser Permanente, to reach out to the African American community and other communities that are disenfranchised?
Absolutely.
Do we have an action plan?
That is an excellent question. I will tell you, when I started in my regional role in January, I became privy to a lot of information and talk about the vaccine rollout that Kaiser Permanente was going to be doing. And when I was looking through some of the numbers, I noticed that among our healthcare workers, many of whom were people of color, they were getting vaccinated at much lower rates. And we know that people of color tend to get vaccinated at lower rates in general for a lot of different reasons. So I will say that Kaiser has been working diligently to reach out to people of color, African Americans, Latinx, really trying to get these communities engaged in getting vaccinated. The big challenge that we have had, that Kaiser has had, that is not unique to Kaiser Permanente, is vaccine supply. And this is a challenge because, quite frankly, in 2020, the federal response to the virus was lacking. and there has been a lot of catch up that has been played as we've gotten into early 2021. Part of that is that we just haven't had enough vaccine to go around. I will say in the next 4 to 6 weeks, I strongly feel that that will be changing. We will have much more of the Moderna vaccine, Pfizer, and once the Johnson & Johnson vaccine sort of gets online, we'll have more and more of that. So the infrastructure to reach out to communities of color within Kaiser is there. We just haven't had supply. But as we get towards middle of March into April and May, I think all of that is going to be changing. And I will also give a plug to say that Kaiser Permanente has actually chosen 2 African American people who are actually in charge of our vaccine response. One of them is Dr. Michael Morris. The other is Lisa Bufong. They're wonderful, wonderful people who certainly are looking to get everybody vaccinated, but have a real critical eye to communities of color and really ensuring that Kaiser Permanente is using all of the power and that we have to make sure that we are vaccinating not only our Kaiser Permanente members, but other members of our larger Los Angeles community.
Thank you for that answer, Dr. Hudson. And are there different strands of COVID in the community? If so, does the vaccine protect from them all?
Excellent, excellent question. So yes, we know that there are definitely different strains of COVID out there. You may have heard about the UK variant. I mentioned the South African variant. There's also a couple of sort of homegrown California variants that we think might have been the reason why we had such a great surge going from November to January. So there definitely are different variants there. The good news is that the Pfizer and Moderna vaccine work well against most of them. Even the South African variant, which happily we haven't seen as many cases of, both of those vaccines both still seem to work well against that variant. So far, so good in terms of the way that the vaccine is responding to all the variants.
Thank you. And is the vaccine recommended for people with sickle cell disease?
Absolutely it is, yes, because people who have sickle cell disease would be considered people who are potentially immunocompromised, yes.
And will it be less effective if you don't currently get the flu vaccination?
No.
COVID.
Yeah, no, there's no connection. I would say it's always important to get your flu shot, certainly. Although this year, I'm sure everyone has noticed we've had hardly any cases of flu, and that's because people are wearing masks, which has really helped to decrease the spread of flu. But you don't need to get the COVID. If you get the COVID vaccine alone, that's fine. It will still be as effective.
And one of the questions is, some diseases have been eradicated by vaccines. Why doesn't anyone think COVID could be eradicated through vaccination?
Yes, that is a question that I asked myself, because we know certain diseases like measles, mumps, we know polio, there have been things we've been able to eradicate completely through vaccination. So COVID's a little bit different in the way that it replicates. It's different than, say, measles, mumps, rubella. They just replicate at a slightly different speed. So it makes it a little bit harder for the vaccine to completely get rid of them. Also, we just have so much of the virus circulating throughout the entire world. We are at a different point right now with COVID than, say, we are with measles or polio. Perhaps one day we will get to that point. It's possible, but it will be a long, long ways off, unfortunately.
And one of the questions is, which manufacturer does Kaiser use most, Pfizer or Moderna?
So I would say Kaiser probably uses them both equal up until this point. I know we're going to be getting a lot more supply of Moderna soon, so probably Kaiser will be using a little bit more Moderna over the coming weeks. But regardless of whichever vaccine you are offered by Kaiser, that is the one that you should take.
And Dr. Hudson, what would happen if I were to get the vaccine and the first dose I was administered Pfizer, and for some reason I return in 21 days to get my second dose and there's no supply of Pfizer and they can only administer Moderna? What would happen to me?
That is a good question. So in general, we don't want to mix Pfizer, Moderna. We want you, if you got your first dose is Pfizer, second dose Pfizer, first dose Moderna, second dose Moderna. However, there can be rare circumstances where, perhaps we didn't have, Pfizer on that day, or maybe someone outside of Kaiser who doesn't have the terrific medical record information keeping that we have didn't know what kind they actually got. So they might end up getting a different kind, a Pfizer instead of Moderna. It will still count. It will still work. Pfizer and Moderna vaccines are so incredibly similar that there would not be a problem if that happened. However, that should not be happening on any kind of a regular basis. It truly should be the exception and not the rule.
Thank you, Dr. Hudson. Very important question that's coming up quite a bit. Why is the vaccine not being administered to persons under 16 years of age? Why is it not being offered to those individuals?
That is an excellent question. As someone under the age of 16 in my household who would love to be able to allow her kid to be a little more like a kid again. The reason for this is that the vaccines just haven't been studied in the 16 and under crowd yet. Right now, however, there are active studies ongoing by Pfizer. They are looking at the 12 to 16-year-old group. There are clinical trials that are actually recruiting, preteens and teens to be a part of this. So probably by the time we get to August, September, there will be a new designation for the 12 to 16-year-olds to be able to get vaccinated. Now, the kids that are even younger than that, the 11 and under crowd, there are going to be studies starting for them towards July. So probably results for them maybe more towards early 2022. So for the younger kids, the vaccine, by younger I mean 11 and under, probably the vaccines will not be approved for them until early 2022.
Thank you. Excellent. And for African Americans and other racial ethnic populations who were less well represented in the COVID-19 studies and trials, how can we know for sure if the vaccine is safe and effective for us?
Excellent question. I actually did a deep dive into the data that Pfizer and Moderna both put out regarding all of their clinical trials, who was actually represented in them, and unfortunately, not surprisingly, these vaccine trials were very heavily weighted towards white people. Primarily, about 60% of the participants were white. I will say for the Latinx and for the African American populations, if you compare the percentages that were in these studies to sort of the census numbers, they actually did a little better than I actually would have thought that they would have. So there was about 17% African Americans and a little higher for Latinx. So they did look at some people of color. So it wasn't like it was like 90, it wasn't a 90% white type of a trial. For the people of color who were within these trials, there were no, we call them data signals. There was nothing that showed, hey, Black people are more likely to have, issues with Moderna, or Latinx more with Pfizer. Nothing showed up like that at all. So that's wonderful. And also, as we get more and more people getting these vaccines outside of the studies in the real world, we have not seen anything that would indicate that these vaccines are not safe for people of color.
Thank you, Dr. Hudson. And we still have quite a bit of questions. I know we may be going a little quickly, but I really, really want to make sure we address everyone's questions. We have about 5 minutes or more, 5 minutes left in this conversation, so I'm going to try to read through all of these questions as quickly as possible. Dr. Hudson, if you could just piggyback on the 16 and under, because they're not able to get vaccinated, how does that impact them going back to school safely?
So that's a really good question. We know that in some parts of the country, in some parts of this state, in some parts of LA County, there are some kids that are going to school. We know that for elementary age kids, they are less likely to get more of the severe side effects related to COVID, but that doesn't mean that they are completely immune from it. We know that kids that are in middle to high school, much more likely if they get COVID, to have to behave more as a quote as an adult would. Although certainly, thank goodness, there have not been a lot of deaths in that age group either. So to get the kids back, in my opinion, and I'm not Dr. Fauci, but I think that we need to get the teachers and the staff vaccinated because they are the ones who we're the most worried about. Kids are beautiful creatures, but we all know they are viral factories. Forget about COVID in general. So kids tend to give us stuff. So we have to make sure that the teachers are really, and all of the staff are vaccinated. That's number one. The kids are going to have to wear masks too. And it's easier when they're older. When they're younger, it's going to be challenging. Keeping physical distance, it's one thing to tell a bunch of kindergartners to do that. It's another thing to tell 12th graders to do it. So this is why it has been just so challenging to get the schools going because there are so many different issues that we have to really think through before we can safely open up the schools. But in my opinion, until the teachers and the staff are fully vaccinated, there's no way we should think about sending the kids back. It's too risky. There's some good, right now there are multiple outbreaks that are actually happening in Canada because they brought the kids back. And I think these are elementary school age kids. The kids have gotten COVID, the teachers have gotten COVID. It's kind of a mess. So we do not want that to happen here.
I know there's still a couple of more questions. What we are going to do is send out an email with the answer to these follow-up questions to everyone on the phone call in the interest of time. I know one of the questions is that LAMC is encouraging their staff and others to get vaccinated, but they don't have appointments available. If I'm correct, and just a thumbs up from our leadership in the hospital room, there is opportunity for walk-in today at 4760 for those who meet criteria. That means you're a healthcare worker, you're over 65, you're a licensed caregiver. There's a newly qualified list of transplant patients. So I just want to reiterate, today we have opportunity for walk-in, but you still have to meet that criteria, okay? That means if you're 24, it's not your turn yet. You have to be over 65, a healthcare worker with some type of identification. Obviously, if you work for Kaiser, your badge is fine. We're taking licensed caregivers, and there's a newly qualified list of transplant patients. Walk in today. We have space if you fit that criteria. Another one of the questions is how can we know the vaccine is safe when we don't see people of color getting or giving the vaccine at LAMC? Dr. Hudson, if you don't mind, I'd like to answer that question.
Please, go ahead.
I am currently deployed at 4760, the vaccination clinic. I am the scheduler, and I am there every day, 7 a.m. to 7 p.m. I can confirm that we have African American and other physicians, RNs, LVNs of color administering the vaccine. I schedule them. Last Saturday, Kaiser Permanente African American Professional Association and the Equity, Inclusion, Diversity Council hosted an event. Again, this is still for those who fit criteria. So, there are African Americans and people of color who are administering the vaccine. I make sure that I see that, and I can tell you, we have African Americans and other peoples of color coming to get the vaccine. I'm there every day.
Thank you, Ms. Mitchell.
Nobody else could answer that better.
So, Dr. Hudson, I want to thank you so much again. Again, in the interest of time, we're going to go ahead and conclude the call. Some really quick notes. I want to thank you, Dr. Hudson. I'd like to thank Dr. Tiffany Hogan, who is our physician champion for the Equity, Inclusion, and Diversity Council.
Oh, thanks.
I would like to thank Kim Bretler, who is the sponsor for the Kaiser Permanente African American Professional Association. I'd like to thank everyone who worked tirelessly to get this done, who is part of EID, Capital Leadership. I want to thank our LAMC community for joining this call. We appreciate you. We appreciate you taking the time out of your busy schedule. Many of us are facing COVID fatigue, but this is a very important conversation. Again, there is walk-in opportunity today if you'd like to get vaccinated or you know someone who does, who fits the criteria. We will also be sending out a survey. We want your feedback. We want to engage in future conversations, so we'd like to know what you want to see and how you would like to have these conversations. Thank you, everyone, for joining. I want to thank our executive leadership, our CAO, Kim Kaiser, our senior leader of KFH, Will Rice, and our area medical director, Dr. Harsaman Brara. Thank you again, Dr. Hudson, for your time. We appreciate you. And for all of you on the call, we will send out an email to answer some of the questions that we didn't get around to. Thank you so much, everyone. Please take care of yourselves. 4760 Sunset Vaccination Tent, opportunities today to walk in. Don't say we didn't have appointments. You can go today.
Yes. Thank you. Thank you, Tivana.
Meeting?